Growing outbreak of cyclosporiasis has sickened thousands of people across the country, and health officials are still working to identify the source. Joining us now is Dr. Cynthia Sears, an infectious disease physician with Johns Hopkins Medicine, to help us understand what this illness is and how people can protect themselves. Dr. Sears, we're so glad you're here.
Thank you for having me.
So the first thing I said to you when I walked up is that I'm still eating my kale salads. Is that risky right now?
Well, depending on where you live in the United States might be the right answer. In Maryland, I think we're fairly fortunate. We have only 150 cases, and 50 have been recently acquired since May 4th. So I'm telling people that if you eat local produce and avoid buying produce that has Salinas, California on the label as the source, which is where Taylor Farms is, then you're in pretty good shape. Nonetheless, I would still wash it vigorously and before you consume it raw.
And that includes the pre-washed brands that we see.
And that includes the pre-washed brands, as well as peeling off the outer layers and discarding them. So in eating, the inner layer is less likely to be contaminated by
But so far, we've
water.
only seen iceberg lettuce associated with this outbreak, correct?
That is correct, but we have an exceptionally large outbreak going on in the United States, and the FDA website now lists 6 separate cyclospora outbreaks. I'm not sure that's correct. The biggest one, of course, is the one that started in Michigan and is pushing 18,000 people now. The second one that they reported with 72 is up to 93, but we still don't have any idea where that is. And then there are 4 smaller ones, and whether they're truly independent outbreaks is unclear.
Why is this so concerning to you as a physician?
Well, it's a diarrheal illness, and diarrheal illnesses really affect the young and the elderly and can cause dehydration. And if that is not dealt with, people can die even. So far, there have been no deaths with this outbreak.
We are definitely grateful for that. What is the most important recommendation you can pass along to our viewers?
Is hydration. So if you develop diarrheal disease and you're concerned, you need to make sure you're hydrated. If you can't keep up, go to an urgent care center, go to the ED so that you can get proper care and diagnosis, because this particular outbreak, unlike many other diarrheal diseases, are not specifically treatable, particularly viral ones. This one can be treated. And so if the diagnosis is cyclospora, there's a way to deal with it.
So how is it diagnosed, and what is the typical treatment beyond hydration?
It's a stool exam, and there's multiple methods used for that. But if the parasites appear to be there, then the treatment is an antibiotic called trimethoprim sulfamethoxazole. Brand names are Bactrim, Septra, taken twice a day for 7 to 10 days. And in general, even in immunocompromised individuals, the response is pretty quick. So it may not be durable in someone who's immunocompromised, but in the average host, it should take care of it.
All right, Dr. Sears, thank you so much for coming and explaining all of that. We're
Absolutely.
really appreciative of your presence.
Thank you so much for having me.
And